Hi, Assalamualaikum. My name is Mazlin Nur Imani. Now I will present my final year project titled Study of Drug Release of Gentamicin in Beaded Chitosan Coated Gelatin-PVA Scaffold under Dr. Nur Mahira Muhammad at Muhammad Nur. Before we go through more detail about this study, we must know what is gentamicin. Gentamicin is antibiotic and belong to the class of medicine known as aminoglycoside antibiotic. It used to treat serious bacterial infection in many different parts of the body. It works by killing bacteria or preventing their growth. Frequently used for more serious gram-negative infection. This drug injected into a muscle or vein through an IV. However, it may also cause some serious side effects if we do not use gentamicin properly. It can harm kidney and may also cause nerve damage or hearing loss. We or swallow breathing, increased pressure inside the skull, sign of electrolyte imbalance, pain where the medicine was injected. The factor of side effect to happen is taking an excessive dose of gentamicin, allergic reaction, intake of doses that do not correspond to the body weight, have impaired renal function. Skipping doses may also increase the risk of further infection that is resistant to the antibiotic. That's why it is important to know how to use gentamicin. To avoid any side effect, we must give the correct dose of gentamicin. The dose of gentamicin is usually based on body weight. Dose adjustment is necessary for patients who have impaired kidney function. We must identify who can take this injection. Do not use gentamicin if patients are pregnant. It can harm the unborn baby. Avoid give to the patient who have electrolyte imbalance with low level of calcium, potassium, and magnesium in their blood. That's why we need to do a study about the how gentamicin released in given period to observe degradation or effusion of gentamicin into gelatin-PVA scaffold. The objective of this study is to fabricate gelatin-PVA scaffold with different ratio. Second, to coat the scaffold with chitosan containing gentamicin. And the third, to analyze the drug release mechanism of coated gelatin-PVA scaffold. Next, the problem statement in this study is fabrication of gelatin-PVA scaffold that has same categorization with bone tissue. Different ratio will produce different structure number of pore in gelatin-PVA scaffold. Second, different coating layer by chitosan produce different reaction of infuse the drug release of gentamicin. Imbalance ratio or layer of chitosan can cause several restriction or diffusion when to react with the gentamicin. Third, high degradation rate of gentamicin in cross-linked gelatin PVA scaffold. Identify the cross-link reaction of two materials occur in correct way or not. And the scope is fabricate the gelatin PVA scaffold that has same characteristic with bone tissue using LSUP method. Second, different concentration 5% and 10% of gelatin PVA and chitosan are used to study the rate of releasing gentamicin. Third, weight ratio of gelatin PVA 9 to 1, 7 to 3, 5 to 5, 4 to 6, 3 to 7, 8 to 2 are used to observe and analyze their characteristics. Fourth, studying and understanding the technique of salt leaching using powder. And the last one, measure the rate of drug release of gentamicin by using cumulative drug release and the kinetic release study based on zero order, first order, Higuchi and Komeyer paper model. Okay, now move to the literature outcome, the most effective method to fabricate gelatin PVA scaffold. The ether Izzat Zulkifli in 2021 meets the compound powder and heat, has good handling property and hydrophilicity, making it simpler to adhere to the wound bed. Next, Yesenia use freeze thawing and freeze drying method, all highly porous with a porosity more than 80% and lean structure. And next, as Sadapon use freeze thawing method, the more intense absorption peak in this region was observed and the amount of PVA increased. Next, Mahanama Hussain used the technique of salt leaching using powder. The sample with high concentration shows smaller pore size. And the last one, Predasin used freeze thawing method. The sample with high concentration shows smaller pore size. The result of this research show freeze thawing is the best method to fabricate gelatin PVA scaffold. Okay, next, methodology. The experiment starting with making the gelatin and PVA solution by dissolve this both material in distilled water. Both solution was blended together in different ratio of gelatin and PVA with cotton still. The solution mixture then undergo freeze thawing. Glutaraldehyde was added homogeneously to the polymer mixture and constantly stirred for 10 minutes. The mixture are transferred to mold and covered with aluminum sheet. The obtained sample were placed in the freezer for 48 hours. Prepare a solution of glutaraldehyde and ethanol that mix in a 1:1 ratio, then immerse the sample in cold solution of GAA ethanol and rinse with distilled water. Obtain the bond scaffold. If no, go to the solution mixture, then undergo freeze thawing again. If yes, evaluate the bond scaffold characteristic by FTRI, SEM, spelling test, and degradation test. Here the step-by-step of experiment that I have conducted. First, weigh process. Second, preparation of gelatin and PVA solution. Third, pour the mixed solution into the petri dish. And this is the sample of gelatin PVA scaffold after I take out from the freezer. The result of the experiment, hydrogen formation occurred at a ratio of 7 to 3 only. The sample of other ratio become liquid, does not form solid shape. There is no porous in the sample. That's all from me. Thank you.